status. Do not resuscitate. A do not resuscitate, or DNR, is a medical order written by the doctor instructing the medical personnel to not perform CPR or intubate a patient if they were to stop breathing or their heart were to stop beating. This order must be given from the patient, or if the patient is unable to communicate, then by the patient's DPOA of healthcare or family. So what exactly is resuscitation? Resuscitation includes a breathing tube, chest compressions, and medications. A part of the resuscitation process includes protecting a patient's airway. So what exactly is this breathing tube that protects the airway? It's otherwise known as intubation, and it occurs when a patient is unable to breathe on their own, whether it be because they are unresponsive or they are hypoxic. This breathing tube is placed through the mouth and down the trachea to keep the airway open. The patient is then either bagged or placed on a mechanical ventilator that assists with breathing. Some of the risks of intubation are aspiration, esophageal intubation, which can result in death if not identified promptly, infection, injury to your mouth, teeth, tongue, vocal cords, or airway, and tension pneumo. The other part of the DNR is CPR, which includes chest compressions and medications. Chest compressions is the pushing fast and hard on a patient's chest to mimic the pumping of the heart. Compressions are associated with sternal and rib fractures, especially in the elderly and those with osteoporosis. Medications are given in an effort to restart the heart. They are usually given through an IV, but can be given through the ET tube if IV access is unattainable. Many patients are unaware that they are able to modify this DNR. A patient may choose whether they want 1, 2, or all 3 measures, which would be a full code, performed. Some patients may not want the pain of going through chest compressions due to age or other comorbidities, and some patients would like chest compressions and meds, but not a breathing tube. One of the biggest misconceptions of DNR is that you are also stopping treatment. This is false. You are not withdrawing from treatments. You are specifying what you would want in the event your heart were to stop or you were to stop adequately breathing. The medical team will still try all measures to prevent your heart from stopping. So why am I reviewing all of this with you? Because when a person ends up in the hospital, it is common that they are never talked to about their code status. If they are talked to about it, they may not be getting an adequate discussion of all the options. Often, patients go through treatments that really serve no useful purpose in attaining their goals. Their goal may be unrealistic given the disease process in which these treatments are futile and expensive. This further increases the cost of healthcare and promotes inequality. Just because we have become advanced in our technologies does not promise a cure. This is where informed decision-making comes into play. With the proper education from the medical team, a patient is able to make an informed decision on their advanced directive. This limits the use of expensive, invasive, and useless care not requested by the patient. Research shows that advanced directives improve the quality of end-of-life care and reduce the burden of care without increasing mortality. So whose job is it to start this conversation? Even though the doctor must write the final order, any part of the medical team can start this conversation and actually should start it if it hasn't been started already, because this is a vital part of a patient's plan of care. Initiating these conversations can alleviate emotional stress, prevent invasive, costly, unnecessary, and unwanted care while aiding families through the healthcare process. Open communication is key in starting these conversations. When communication is effective, it leaves all parties involved satisfied. When communication is clear, there is no room for misunderstanding or alteration of messages. According to Becker, communication interventions are associated with better patient knowledge in regards to a DNR. Communication must include what the patient deems as quality of life and if this aligns with their current prognosis and treatment. Technology does allow us to live longer, but would it align with a patient's idea of quality of life? These conversations need to be started before the patient is unable to participate in them. And these conversations begin with us.